One of the nation's leading vaccine experts says the U.S. ignored warning signs in the early phases of the coronavirus outbreak. Dr. Rick Bright testified before the House Thursday. Bright says he was removed from his job as the director of the Biomedical Advanced Research and Development Authority for raising concerns about the Trump administration's response to the pandemic. Skylar Henry is at the White House with the latest.
Needed us, and we rose to the occasion.
The owner of a major U.S. surgical mask manufacturing company told a House subcommittee the Trump administration ignored his offers to ramp up production in the early months of the coronavirus pandemic.
The DOD, the VA, the CDC, and HHS could have worked together to secure America's mask supply.
Whistleblower Dr. Rick Bright of the National Institutes of Health echoed those concerns before the same panel earlier, adding that 2020 would be the darkest winter in modern history if more isn't done at the federal level to combat the virus.
We do not still have enough personal protective equipment to manage our healthcare workers and protect them from influenza and COVID-19. We still do not have the supply chains ramped up for the drugs and vaccines, and we still don't have plans in place on how we distribute those drugs and vaccines.
Bright filed a whistleblower complaint claiming he was transferred from directing a vaccine team at the Department of Health and Human Services after he pushed back on the wide use of anti-malaria drugs, chloroquine and hydroxychloroquine.
When I learned that there is a directive to make it more broadly available, not under close supervision of a physician, I was...
When was that? When HHS says Dr. Bright's complaint is full of one-sided arguments and misinformation. President Trump continues to call Bright a, quote, disgruntled employee.
I never met him. I don't want to meet him, but I watched him, and he looks like an angry, disgruntled employee who, frankly, according to some people, didn't do a very good job.
The president traveled to Pennsylvania to tour a personal protective equipment manufacturing facility and to announce an initiative to revamp the national strategic stockpile to make it less reliant on supplies produced in China.
Under my order, it will now also invest in our country, helping to bring vital factories, pharmaceutical producers, and most importantly, jobs back home where they belong.
The president says he wants to replenish the national stockpile by the fall. Skylar Henry, CBS News, the White House.
Anita Kumar joins me now. She's a White House correspondent and associate editor for Politico. Anita, good to see you once again. What did Dr. Bright say about the U.S. response to the coronavirus, and what steps does he believe officials need to take moving forward?
Well, he talked a lot about how the administration wasn't ready for this. And the reason he said that was because he said he warned officials in the administration that this was coming, that this was going to be an issue, and that they didn't prepare. They downplayed it. The same criticism we've heard against President Trump for the last couple of months, that they didn't prepare for that. That's why, medical supplies, tests, and other things were not ready to handle that. And he had a really strong warning about what's to come in these next few months, where he says it's going to return, as we've heard other medical doctors talk about, and that the administration won't be ready. And he thinks that it's going to be the same situation that the administration faced just a couple months ago.
Well, a central point of Dr. Bright's whistleblower complaint is that he was removed, he says, for raising concerns about the drug hydroxychloroquine. President Trump had touted it as a potential treatment for the coronavirus. How are the president and top officials at the Department of Health and Human Services responding to Dr. Bright's claim?
Well, you're exactly right about that. One of the things he said was that the president's whims, some of the things that the president said, and also political connections were the reason that decisions were made, not medical science. The Department of Health and Human Services has sort of just said they're not going to talk about personnel issues. But the White House, the press secretary there, and the president have pushed back. You heard what the president said just a couple minutes ago when he talked about how this was a disgruntled employee. But, the press secretary at the White House did do some interviews about this today. And she said, look, all the things that Dr. Bright mentioned, the playbook, if you will, of what needed to be done, we actually did do. We ended up, doing all those things and, getting all that done. And so what is he talking about? All the things that he and others outlined are the things that were done. And so they're saying that there's nothing there, basically.
Well, Anita, we have also learned that Jennifer Santos, the Pentagon's industrial policy chief, was fired Thursday. She was responsible for overseeing efforts to use the Defense Production Act to produce more PPE, personal protective equipment. What more do we know about her dismissal?
Well, we do know that people there took it by surprise. They were not expecting this, and she wasn't expecting this. She was fired for that job, but will go on to another job. And we do know that this was something that the White House or the highest levels of the administration were looking at. This wasn't something by her direct supervisor. The president and the administration has been criticized for not using this act soon enough, that the president delayed in using this law, which would force companies, industries to help manufacture these supplies that were needed. And so, there has been a lot of criticism on that, but really the criticism that I've heard is really from the White House coming, to the president. He didn't act fast enough. And it is the president that needs to use that act for this to get going.
I want to ask you about a new CBS News poll that found 38% of Republicans believe the top priority for the country should be staying home to slow the spread of the virus. Now, that's compared to 88% of Democrats. Meanwhile, 62% of Republicans say the top priority should be going back to work to help the economy. That's compared to just 12% of Democrats. So huge divides there, Anita. Does this partisan gap reflect what we're hearing from the White House?
I think it really does. The polling is really interesting because the last few weeks we have been seeing this partisan divide across the country, and the White House is recognizing that. The president, a lot of the people that he talks to, and remember, he talks to a lot of business folks, even before coronavirus, he was always talking to business people. These are his friends, people he's known prior to him becoming president. Are saying that we need to go back to work. Everybody needs to get back to where things were before for the economy to turn around in the next couple months or the next few months. And so he's really been hearing that. But more than that, he's been hearing it from elected officials on Capitol Hill, Republicans. He's been hearing that from elected officials across the country in state races and state legislatures. So there has been some divide. I actually find it interesting that Republicans are not completely in tune with this either. I mean, they're a little bit split there as well. Some Republicans are saying they do want to still stay home. So it's not one way or the other, but definitely more Republicans are saying that they do want to go back to work. And you can see that by some of these protests that are against a lot of these Democratic governors that have resisted that.
Well, our poll also looked at President Trump's handling of the coronavirus outbreak. 43% now say he's doing a good job. That's compared to 48% in April and 53% in March. Anita, in what ways are we seeing both the White House and the Trump campaign try to shape public opinion?
Yeah, those numbers are interesting, but there were a lot of polls that showed he had a little bit of a bump right when the coronavirus pandemic started, that he was out there in front trying to do something. I think you see this was similarly with past presidents. When there's a crisis going on, you look to the leadership to see what they're doing. But that bump has gone away, as you can see, and we're back to basically the numbers that the president has had throughout his presidency. So we're back into the 40s, even the low 40s. There are a lot of criticisms that have happened that have been very public the last 2 months. Criticisms that the president downplayed this in the very beginning, like Dr. Bright said, criticisms from states and local officials saying we didn't get the supplies we needed, and criticisms from hospitals. So I think you're starting to see that people are, that's showing up in the polls, all that criticism, all those things that Americans have heard for the last couple months. And the president and his campaign and the White House are aware of that. They are trying to pivot to other things. They're trying to show that he is acting and that he did act, but they're also talking about a couple other things, that he's getting along with state leaders. This is a new development that they've been trying to tout, that getting along with governors, working in a bipartisan way, and that they're talking about China, how China was to blame. You see that a lot from the Trump campaign and his allies, talking about how if China hadn't let this pandemic get further, escape China and get to other countries, the United States wouldn't be in the place that we are today. So they also happen to think that Democrat Joe Biden is not very good on China, that he's weak on China, and they want to show that the president's very tough, that he's going to be tough on China in the coming months if he gets reelected.
You mentioned governors a moment ago. Well, governors received more positive reviews than the president. 66% say their governor is doing a good job handling the outbreak, compared to 43% who support the president's handling. Anita, you recently wrote about how the president is trying to use these meetings with governors to benefit his re-election campaign. What more can you tell us?
Sure. The president has met with 10 governors in the last 3 weeks, both Republicans and Democrats. He's invited 9 of them to the White House for meetings where, they'll talk about the pandemic, things that the states need. But mostly it's the president praising the governors, and then the governors generally are praising him right back. You'll see that some of that praise is being touted on Twitter and social media by the Trump campaign, particularly from the Democrats. The Trump campaign has put out 2 videos, one digital ad and one video showing Republicans and Democratic governors praising him. So he's very much wanting to do what I said before, which is show that he is responding. This is in a bipartisan way. The federal and state governments are working together. He's just trying to show that he is doing what needs to be done. And he is knowing what he does know what those polls show, and that these governors have a 20% or more higher approval rating than he does. So generally you see, as someone said to me, governors going to the White House trying to bask in that, limelight of the White House, but actually it's the other way around. The president's trying to use the governor's popularity to help himself.
Yeah, it's been really interesting to watch that dynamic unfold. Anita, I want to turn to another development. North Carolina Republican Senator Richard Burr is stepping down from his position as chairman of the Senate Intelligence Committee. It comes after the FBI seized his cell phone as part of a federal investigation into his stock sales. How significant, Anita, is Burr's decision to step down, and also this investigation against him?
Well, my colleagues on Capitol Hill reported that a lot of the senators did not realize he was going to do that. So it was surprising to a lot of them. Reporters actually notified some of them of his stepping down. But Senator Majority Leader Mitch McConnell said that he thought it was the right thing to do, that Senator Burr said this morning that he was going to step aside. They're not saying it's a permanent thing. What they're saying is that it's while this investigation is going on. This comes as a lot of legal experts who are watching this are saying this development that the FBI would seize or take his cell phone as part of this investigation is extremely serious. I mean, obviously, that's probably extremely serious at any time, but to do this to a sitting senator, it was extremely serious, and means that they do believe that there is a case to be brought. Whether that comes forward or not, we don't know, but there is some evidence there. They had to convince a judge that there's some evidence. So people are taking this very seriously, and there's a lot of talk about whether he might step down from his Senate position, but he says that he will not be doing that.
So another Republican senator, Kelly Loeffler of Georgia, is also facing questions about her financial transactions following a classified briefing on the coronavirus in January. Is it clear, Anita, why Senator Burr appears to be the main focus of this investigation right now?
Well, it isn't clear, but what you are finding, I believe Senator Loeffler declined to comment about her situation with my colleagues, but other senators also have had some transactions that were under investigation or being looked at. And I think Senator Dianne Feinstein, a Democrat of California, said that she also was contacted. Now, she didn't say anything about a cell phone, but she said that she was contacted and that she did turn over documents. So it's clear that the FBI is looking into all of this. I do think that with Senator Burr, there is a couple different wrinkles. One, he is the chairman of the Intelligence Committee. 2, his brother-in-law is also under investigation, or being looked at anyway, for doing something similar. And so there are a variety of people that are saying that Senator Burr, as the chairman, should have known better, does know better, and that makes it even more serious.
All right, Anita Kumar for us. Anita, always good to have your analysis. Thanks very much.